All right, I'm very excited to have one of the most brilliant bioethicists in the world joining me from his home. He is at NYU Langone. He is Dr. Arthur Caplan. Thank you, as always, for joining me in conversation. So much that we have to learn from you. First of all, how do you feel about the fact that I'm having 12-year-olds over today to have a snuggle party? Is that a good idea or a bad idea?
Bad idea. Probably
Oh,
wasn't bad. It was probably a bad idea before the coronavirus thing. The truth,
fair
but
enough. Well,
still a bad idea. So I know people they got the kids home, a lot of them. They're isolating, and the temptation is invite some folks over. I would try not to do that over the next week or two. Let them talk to each other online. Let them text each other, that sort of thing. But really, you know, having a bunch of kids come over to play, and they do touch each other, and then they go back, and then their relatives are in there, and it undercuts a little bit the idea of the social isolation. So I'll just put it this way: the more you can hold out without extreme dementia setting in, the better.
no kids should come over to my house. My kids shouldn't go to their houses. Can
Right
they?
now, no. Right now, no.
What is your week time frame that you just mentioned about?
I think what we're going to see is this week and next week an escalation in the number of cases. We're going to know really a lot more about who's infected and who's really at risk. So that virus takes 5 or 6 days to incubate and show symptoms. If your kid's friend came over from a house where somebody was infected, we wouldn't necessarily see it yet, but if they get tested because they're in an at-risk group, now we're going to know that their kid's at risk. You didn't want them to come over. It's that sort of thing. So let the testing go on a little bit. If you know that the parents, everybody who's living in the home where the kid is, all tested negative because they were, worried that they were at risk group, then we start to relax all that and say, okay, some socializing. Nice to play outdoors, by the way, not indoors.
Exactly. And the weather's gotten uh, at least cooperating a little bit
Yeah,
here in these
yeah.
first couple of days. It'd be that much
But
worse.
you follow that, right? So it's the reason you don't want the kids coming over is not just that the kid, you're worried about them being infected, but the parents or the grandmom or somebody may be infected. They infected the kid. They're not going to show it in themselves for, say, 4 to 5 days. Then the kid won't show it for 4 to 5 days. So you're just trying to get ahead of that. Let's call it a week window.
Right. So my wife, very generous friend, was bringing her on vacation to Mexico this week, this Thursday. Should she go, Dr. Kaplan?
No, I don't think so. I had a trip. Believe it or not, I know this will be hard for many viewers to believe, but I'm 70 and I had a 70th birthday party, Maui. I mean, nice gig.
Hawaii?
Canceled it. Canceled it.
Well, that's why I invited you on today. I knew that happened, and this whole interview is a surprise party for your 70th. All right, everybody, come on in. All of your friends came to my house, and we're all going to be in my tiny studio. Do you suggest that your friends keep social distance in this studio? What about socializing?
Well, tell them not to high five each other. How's that?
Just elbow bumps and foot.
Elbow bump.
So,
By the way, can we believe that the president
yes.
continues to shake hands, continues not to show his hand sanitizer when he's wandering around, which would be a nice thing to do? He continues to hang around with people who are known to be infected. I mean, what kind of role model is this?
I'm going to stump you for the first time ever. This isn't a bioethics question per se, but what behavior has Donald Trump ever role modeled that's a behavior that is appropriate that folks should follow? Sir?
Taking a nap, which he seems to take extraordinary numbers of for long periods of time, but it's not a bad practice.
I thought the Surgeon General said he doesn't sleep very much.
Well, we can't model our behavior on him. He's a paragon of vigor and health. So
a lot of young people seemingly, I guess there's this idea that they're invincible because they're in their 20s. Maybe they're not paying attention to news, but this weekend, people were outraged that young people were out at bars and restaurants. We're taping this Sunday morning where there's a line out the door for brunch in certain places and cities. What about going to bars and restaurants and hanging out and socializing in places like that?
no bars. Don't stay in the restaurant. Do take out. Get it delivered. we're kind of in that crucial period again, Pete, where testing is beginning to appear. We'll know better who to isolate, who actually is infected. Let the next 2 weeks, let us figure out who's actually the real risk groups, and they'll know that they have to stay home, and then the rest of us can wander around a little bit more. But right now, I do all takeout. I wouldn't be going to the pub, the club. I wouldn't be eating my meals in the restaurant. Obviously, some people rely on restaurants, and the restaurants, we need them. They feed a lot of people around the New York area in particular. So those, I think it's good for Seamless and Grubhub and Uber Eats and all those places.
Yeah. Tip your delivery guys, usually guys, extra. What about the schools, the school closings? This is a simple issue for those of us that have means, that have food. It is a much more difficult issue for those living with much fewer resources, those who have to go to work, parents. I think it's hard for most people to understand how difficult it's going to be for folks living on the lower end of the socioeconomic ladder. Explain why this is such a controversial thing in New York City and in other places, whether or not there's closing schools.
Yeah, school closures, which our mayor has been fighting because he knows if you close the schools, parents stay home. Now, we've just said 18 times that we want people to stay home, except there are some people we don't want to stay home. Nurses. Got to have the healthcare workforce coming in. If they don't have child help, we get a crisis because we're not sure who's going to be able to step in and help them out. That would have been preparedness planning to say, we do have some place they can go, which is safe, which we're going to keep them, isolated from one another, or to have social distancing or whatever it is, but we haven't planned for that. If you're homeless, I took a look at a shelter picture just from this week was actually in New York, but it could be anywhere. There's no place to send the kids back that they're isolated. They're sitting on top of one another in there. Again, no planning to try and space out a little bit. The shelters distribute people more broadly, that sort of thing. It's not that everybody can't cope when the kids come home. Some of the kids will probably die when they drive their parents crazy, not from the flu, but
Yeah.
there are subgroups where you really want to pay attention and say, we've got to help them out. We got to send some help in there, somebody to look in on the older kids because their parents won't go to work. And if they're doctors, techs, phlebotomists to do blood tests, nurses, you don't want them staying home because they don't have anybody to be with the young kids.
Dr. Caplan, explain how woefully unprepared America's healthcare system is for this and welfare system or social safety net compared to some of the other European countries or even Asian countries that we've seen, Australia too.
Yeah, sadly, every rip in our social safety net just widens up to a gigantic tear when you have a pandemic. And what I mean is, if you have, let's say, uninsured people, and we got lots of them, even with our current programs, there's still many, they may say, I don't know, I can't afford to go into the doctor. I can't afford an emergency room visit. I'm going to stay away, and I'm just not going in. They become obviously sources of infection, and they could hurt and kill themselves. We have people who also face big copays. Yeah, they have insurance, but it's crummy insurance. So they're worried about getting a test or coming into the healthcare system. Got a fair number of people who are undocumented, right? People who are here without papers, who've never solved the immigration problem. Every time the president gets near healthcare, he says, I don't care about those people. Remember, he said he wasn't going to give them flu shots.
Right.
Is he not going to give them coronavirus shots? Well, one thing we could do is, where is the amnesty and say, hey, if you feel sick, come on into the doctor. We're not going to deport you. We'll wait a year and figure out what to do. He's still babbling on about a wall, which viruses don't care about, but it might be nice to encourage people to use the healthcare system without fear. Last group, you've got a lot of folks out there on the hospital side who just aren't trained and ready to deal with what to do when there's a breakout. It took too long for us, for example, to shut down the nursing homes. They're obviously full of people at risk. They can communicate the virus easily within the institution. We saw that out in Washington State. So we should have had those nursing homes blocking visitors, starting to bring meals to people in their rooms instead of having them eat together, I don't know, weeks ago. Too slow on the response. And while we don't think of nursing homes as part of the healthcare system. They're an essential part of the healthcare system.
For sure. What about the testing? We have seen this drive-through testing in South Korea. I believe that I read yesterday that South Korea and the United States both reported in the same day, and maybe was it far back as January, the first case
Yeah.
of COVID-19 in our respective countries. They had a different response in terms of testing than we had. They immediately ramped up these drive-through testing, which apparently was something, a plan that they, it's not like they're making it up on the fly. And here in the U.S., Jared Kushner is punching himself in his own face.
Jared Kushner, again, leading the charge this time. If he's not getting in the Middle East, he's going to solve plagues. Well, he's a talented guy. I don't know, maybe. Anyway, South Korea clearly was ready to ramp up, partly because they had rules in place that let them go fast in producing the test kits. We wound up having an incredibly ridiculous bureaucratic fight where initially our CDC said the protocol for tests is you have to send tests for coronavirus to Atlanta from wherever you do the test. Are you kidding me? It's not like there aren't qualified labs all over the country that could do this. That was just the protocol. And they didn't waive it quickly. We had companies who wanted to start making kits. FDA said, well, unless they're certified and you prove them according to the usual rules, no good. Makes no sense. These tests aren't that dangerous. You'd even take a little bit of inaccuracy that you might not accept in normal times just to get them out there. That's a gigantic screw up. And I blame the White House not being all over this, and I blame the CDC and the FDA for being too bureaucratic.
Is there anything that you can see, and many of us have learned about this idea of flattening the curve? We've got to try to bring down the number of cases so that they don't inundate hospitals all over our country, and so that doctors don't have to decide this nightmare situation, who lives and who dies. And so, well, first of all, let me just ask you about that. You're the bioethicist. The situation that doctors and physicians have found themselves in Italy and probably in other countries, maybe Iran as well, is just that, right? That's what we're reading.
Right.
They're having to choose who lives and who dies. How is that seen in your field of bioethics?
Well, sadly, it's not an unknown problem. For example, Pete, every day there aren't enough organs to give out for transplant. People have to make decisions who's going to live and who's going to die. It happens every single day. Occasionally in the flu season, you get overrun in a particular hospital with flu patients. You got to shut the ER down. You're diverting them elsewhere. During the diversion, some of them are going to die because they're not getting care right away. And we know, there could be a bombing, a train accident, a building can blow up. So there are occasionally times where there's a big rush onto services and you got to make choices. So it's not unknown. I don't mean that it makes it easier, but it does exist within our system too. I think the answer is the Italians apparently said they're going to do young people first, end of story. I don't think that's right. What we try to do here is who's most likely to benefit as the driving rule about allocating a scarce resource. So a very sick, a young person with terrible injuries, even a terminal illness, they might not get access to a bed or a respirator at the same way that an older person who's very healthy might. So you get a healthy 60-year-old, you get a 25-year-old who's got some brain tumor. We're not putting that person first with a tumor, even if they're 25. So what I mean is we try to use a little bit of utilitarian thinking and say we got scarce resources. How do we save the most lives? And you know who makes that call? It's the doc in the hospital. You can have all the rules you want. You can have committees. We could put you and me on Zoom and have them, call us whenever it happens too fast. They're sort of there like bang, 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 got to decide this, move this guy out, put this guy on. So they have to understand what the rules are. And I'm pretty sure they do. That's an area that I'm not so worried about.
Do they, and will we have to make those decisions based on what? The age of the patient, the likelihood of their survival based on other conditions? I mean, if you've got grandpa over here and he's got some kind of respiratory issue, and then you've got a child, God forbid, we haven't seen it manifest too badly in children, or a younger, healthier person. I mean, what is the criteria?
So here's how you think it through. You first do your medical workup and you say, there's Art. What's he got? He seems to be in respiratory failure and he has underlying diabetes. He seems to have hypertension. He's been in with 3 previous heart operations. There's Pete. He has respiratory problems, but we don't see anything else with him. It's just he got the virus, but he has no obvious other medical problems. So the points are stacking up against Art, not just because he's older, but because he's sicker. And so the likelihood of responding to the ventilator, to the care that we know you need if you have pneumonia and a very bad lung infection is less. If you still have more people and they're all coming out tied, so to speak, then you're probably going to do first come, first serve. If it's Pete, Pete's brother, Pete's wife, they all have respiratory problems, but no other medical things that would let you sort them out, then you're probably going to go first come, first serve. There's a little bit of evidence, by the way, that men don't do quite as well as women with this. That could become a criteria to put your wife before you, other things being equal. So again, you can hear me, I'm trying to think efficacy. What's going to work? What's the most likely chance of making this scarce resource save somebody?
Is there an ethical choice or decision with, I hear the way that you actually die is pretty horrific, like drowning, basically, respiratory, just having a hard time breathing. Is there an ethical solution to alleviate the pain and suffering of someone that is at the end stages of this?
Yes. Two things. One, I know it's horrible to say, but renew that conversation with your loved ones about what you want. If you're really spiraling out, it's important they know, don't pound on Pete, don't give Art the max thing, let him go. If it looks like he's really, really suffering and the odds of anything happening are tiny, let him go. So have that conversation. We have plenty of time. We're all at home. You can enjoy Netflix and talk about dying at the same time. What an opportunity. And then I think it's important to realize we do have morphine. We do have drugs. We can take care of you if you really get into terrible suffering. Right. A little nervous that because of the opioid crisis, there might be a little reluctance to use them, but hopefully, we can overcome that in the face of a gruesome death.
All right, final question. What are you seeing and predicting? You replied to a tweet of mine yesterday about get ready for 30 to 60 days of isolation. What are you seeing happening in the next 7 days to 2 weeks?
I'm afraid we're going to see cases zoom up. They're really going to be a lot more because the testing is going up. And we've had some time now for the virus, if you will, to be percolating along without symptoms. And I think some people will start to show sickness. When those numbers begin to rise next week or the week after, don't freak out. It's only that we're seeing what was there. We're not getting more infections. It's just that the ones that were out there, we didn't know it because we never got on the ball with the testing. But I worry we're going to see a lot of anxiety and panic. It's back to the supermarket. I'm buying some more toilet paper. There's no reason to freak out about those supplies, by the way. They're still going to be in the grocery stores, and we're not going to close the grocery stores down. So I wouldn't go crazy that way. The reason I say 30 days is when you see the numbers begin to bump up and we get more infection, then we're going to know who has to be isolated. And I think it's going to take another couple of weeks to sort of let that all pass. Sad news. Not sure this virus is going away. We may get to the point where we say it's at a low level. Let everybody back out. We're going to let everybody go back to school or have some sports or whatever. But I have a feeling we're in a new era now until we get a vaccine, until we get a drug that cures it. I think we are going to be practicing more hand hygiene and, some social distancing and protecting the elderly in nursing homes. I'm going to say for the year.
If I'm single, I have to date for 2 weeks before touching.
That is correct.
And even then, how do you know? Like during that 2 week period, it's not like you were isolated that whole time. You could contract it. It's like even sexual contact. I mean, how about just sex without kissing?
Has anybody checked out the numbers on Pornhub this week?
Oh, I'm sure. I'm trying to think of industries that are doing well during this time. And great. Yeah, porn would be a really good one.
Yeah, invest there. Don't hoard your sanitizer to sell it online. Buy stock and whatever that is.
All right, pal. I thank you very much for your time today, and I'll be looking for you. Follow him on Twitter at Arthur Caplan, and that's all here on the screen and in the show notes if you're watching on the video. Thank you, sir. Appreciate it.
Thank you.
Hey, family. Thanks for watching. If you like what you see and you want to support me with a paid subscription, that'd be awesome. Patreon.com/Pete Dominic. Patreon.com/Pete Dominic. Thank you.